Yes, evening, John, from another dormant industrial estate. The lack of activity we've seen here hardly surprising when you look at the number of workers now that the taxpayer is now paying to stay at home. When this furlough scheme was first announced by Rishi Sunak, the government thought they'd be stumping up the wages for 3 to 3.5 million people. This afternoon we discovered it's 6.3 million people and the cost, £8 billion. This afternoon the Chancellor Rishi Sunak said to ITV News that it is not a sustainable situation. The fear for industry is that the furlough scheme runs until the end of June. What happens then? Well, Mr Sunak said there will be no cliff edge to the furlough scheme. I'm working as we speak to figure out the most effective way to wind down the scheme and ease people back into work in a measured way. The question then, how do you get people back to work? Well, the government has been working on a set of 7 documents for 7 different industries to work out how they get back. Now, these are just drafts, they will evolve, but the one notable message from them is that 2 metre social distancing that's been so drummed into us, in some situations, that could be relaxed. The message from industry so far today has been, well, look, we don't want coulds, what we want is certainty. Day 1 of socially distant working, complete with queues, face masks and temperature checks. For Ford in Germany, this is the new reality. For motor parts manufacturers in the Midlands, it's still a distant dream.
They've been closed for 5 weeks now.
5 weeks?
5 weeks.
If he can do it safely, John's keen to get his factory back up and running. The government is too, but guidance on how to do that is only a draft right now. And yesterday, 7 sets of documents were sent to industry bodies for consultation. Indecision is costly though, says John, and every day the price of production returning is going up.
The longer we leave it, that stock is going to disappear, and supply and demand says, well, as the stock disappears, the price is going to go up. So no matter what we do, whether we buy it now, we could be wasting money. If we wait, it's going to cost us more money.
With changes to shift patterns, numbers of staff on site and a whole lot of care, John thinks work could resume here while ensuring social distancing. But that's not compulsory, according to one of the drafts seen by Channel 4 News. The document says it will not always be possible to keep a distance of 2 metres, and so employers and employees must do everything they reasonably can to reduce risk, including staggered arrival times, one-way systems, floor tape or paint to mark areas, plastic screens and an end to hot desking. But PPE is not yet mentioned in the documents. Of course, these documents are drafts and will change before they're finally rubber stamped. But flicking through, the one phrase that comes up time and time again is, quote, what we expect employers to consider. And what employers are saying is, don't tell us what we should consider. For the good of our employees and our businesses, tell us what we actually have to do by law.
It's no good not having the rules and regulations. If they're going to be rules and regulations, what are they? And define them properly. Is it going to be a basic mask, a basic face mask, or is it going to be a filtered face mask, or more than that? Those are the things we need to know.
Trade unions say what they've seen of the government's draft proposals could endanger workers' safety, and as yet will not be getting their backing.
We can't have guidance that is vague and weak, full of holes. There is nothing in this guidance on PPE. It asks employers to consider social distancing or even having soap and sanitizer available. I mean, that's just not good enough.
The guidance offers little hope of a return to normality in hospitality, though. Bars, seated restaurants and cafes must be closed, they say. Food and drink outlets serving takeaway only. Employers like John think there could be one other problem for government. After weeks of telling workers wherever possible stay home in no uncertain terms, they may want to keep doing just that if official guidance to employers is anything less than certain.
Paul McNamara reporting. Now, tomorrow the Isle of Wight will become the first place in Britain to try out a mobile phone app that could lead the country out of the coronavirus lockdown. The Health Secretary says NHS workers on the island will be the first to be offered the government's new contact tracing programme. The Scottish Government announced details of its own tracking and tracing system to try to isolate coronavirus outbreaks. Our political editor Gary Gibbon has this report.
Isle of Wight Radio News at 4. The Isle of Wight is leading the way with a new contact tracing app.
The government hopes that half the population on the Isle of Wight will download the COVID-19 app, allowing the government potentially to roll it out nationally this month.
If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do.
You can play your part in the UK's fight against coronavirus.
The app asks for the beginning of your postcode and a health update. It's being launched alongside a test, track and trace programme, which the government hopes will also roll out nationally in a couple of months. The Department of Health said the app would start being available to some on the Isle of Wight, council workers and NHS staff from tomorrow afternoon. The government says it wants 50 to 60% of the population to download the app, but says lower rates of download could still bring benefits.
I've got nothing to hide and I'm willing to download the app if it's available on iOS, Apple. But at the same time, what are they going to do with that data? Is this just a nice way of them to track me?
It doesn't actually bother me. I think with the current situation and people losing their jobs, I think the quickest way we're all back doing normality is a great thing for everyone.
The government acknowledges the app could struggle to reach some children and many of the elderly.
I will have a problem downloading the app. I don't download apps. If I really need them, I get somebody to do it for me. And then I have to understand how to access them. We have sophisticated phones, but we don't use them in a sophisticated way.
Order. Speaking on a link in a Commons debate, one Tory MP attacked the government's decision to go for what's called a centralised app, sending data to a central server rather than keeping most of it on the smartphone.
It is just an essential principle of our democracy and our freedom that we are not tracked by the state. And I think that the centralisation of this data is entirely wrong. And I think it should be, I would dump the centralised design and I would dump it now.
As barbers' shops reopened in Spain, also in Bosnia and Greece, taking their first small steps out of lockdown, there was pressure from some Tory MPs to refocus on the economic costs of shutdown here and relax draconian measures sooner rather than later.
People have been stopped by police, for example, and told that they're not sweating sufficiently when cycling, or that yoga isn't exercise, or that they've sat too long on a park bench. Well, there's a whiff of tyranny about that. It's absurd, apart from it was laughable. It'd be laughable if people weren't being fined for these kinds of non-offences. If the economy isn't opened up soon, in the next few weeks, then we are going to face extremely serious consequences. And I think the public will be asking, when they look at what we've learned about this disease since we went into lockdown, they'll be asking, were the balances of costs properly considered?
I'm grateful to the huge enthusiasm shown by islanders who know that by participating in this pilot, they're at the forefront of helping get Britain back on her feet. Where the Isle of Wight goes, Britain follows.
Matt Hancock said an island was ideal for the app pilot. The official in charge of the app said things would inevitably not work perfectly at launch, and the app was bound to evolve in the coming days.
Gary Gibbon reporting. Well, now joining us now is Sir Jeremy Farrar, who is Director of the Wellcome Trust and on the Government Scientific Advisory Committee, SAGE. Sir Jeremy, last Thursday, Sir John Bell appeared on this programme and said a vaccine could be available as early as this autumn. Do you think that's still possible tonight?
Yeah, I think a vaccine available that has been through very early testing to show that it's safe, that's an absolutely critical finding for any vaccine, of course, and to show that it's starting to generate antibodies, which we believe are going to be protective. That is very important. But having a vaccine in September is not the same as having a vaccine for 60 million people in the UK or for 7 billion people globally. And that's got to be the focus. A safe, effective vaccine, but then it's available to everybody that needs it in this country, but also critically around the world.
Is there enough global cooperation, enough global money indeed, to really give the vaccine the chance it needs?
The global cooperation, since I first heard about this growing problem in the first few days of January, and the global cooperation since then has been nothing short of staggering. The research community, from both the academic and the industrial sector, and the willingness to share information, I think, has been totally unprecedented. But really important to remember, it usually takes 10 years plus, more than 10 years, to develop a vaccine that we know is safe and effective. We're trying to do that in, we hope, 12 months or less. That's an incredible undertaking. I think it's possible. I think if we align absolutely everything from the science, that a number of vaccines are developed, and that we think the whole way through regulation, through testing, and through global distribution, yeah, I think we can be optimistic. There could be a vaccine within that 12 to 18 month period. But it will take an enormous global effort. It will take enormous funding. And yes, it will take a global cooperation.
And if indeed one is discovered or found in some way, does the global community have the capacity to manufacture enough to vaccinate the vast millions that require vaccination?
Today it does not. No, let's be really clear. Vaccine manufacturing capacity in the world today is there to provide the essential vaccines we all need and all our children receive around the world. That's what it's there for. There is not enough surge or spare capacity to suddenly produce enough to offer to potentially 7 billion people worldwide. And remember, it's not just the vaccine you need to produce. You need to make sure there are syringes to give it, distribution networks to make it available, cold chains if it needs to be kept cold. There's apparently a glass shortage at the moment, so if the vaccine has to be put into glass vials, we need to make sure that we have all of that available. And what we can't do is have a vaccine in September and be able to start manufacturing it, and then some point in December or early next year realize that we don't have the syringes to give it. This is going to take a logistics plan and a development program, the likes of which we've never seen before. And that's going to require a global coordination. It cannot be just done by any single country.
There seems to be a buffer that's being invented in the form of test, track and trace. Are you a fan of this?
I think it's going to be absolutely essential. Going into the lockdown and the restrictions that we've all been under for the last weeks and months, which everybody appreciates, has caused immense hardship to many, mental health issues for many, and particularly in vulnerable populations. Lockdowns are a time to, buy yourself time. They may reduce the peaks of the epidemic, but they're not a true exit strategy. The exit strategy's got to come and will be harder than going into the period of restriction. And to come out of it, we're going to have to reduce the number of new cases every day. We're going to have to make sure our hospitals can cope with it, protect our healthcare workers with PPE and other protective, look after people in care homes and in prisons. And then we're going to have to be able to test people. People will have to be willing to be isolated when they're positive, and we'll have to contact everybody that they've been in touch with to make sure that they don't get infected. That's going to require a planning process, a logistics process, which is going to be even more complicated than the testing that was initiated at the start of this pandemic.
Sir Jeremy Farrar, thank you very much indeed for joining us. Thank you.
Now, it was opened a month ago to much acclaim. London's vast NHS Nightingale Hospital was described by Prince Charles as an unbelievable feat of work. Now, a month on, it will be closed to new patients and placed on standby. A testament, perhaps, to the work of other hospitals that its excess beds were not needed. The focus is now shifting to setting up rehabilitation units to help the most seriously affected patients make a full recovery. Our health and social care correspondent, Victoria MacDonald, reports.
The Nightingale Hospital in the Excel Centre in East London was opened amid much fanfare, with the potential for 4,000 beds. In the end, about 65 patients were treated here, and now it's to be mothballed. In a message to staff today, the pop-up hospital's chief executive, Professor Charles Knight, said the facility will stand ready if cases in the capital begin to climb again. He said,
Thanks to the determination and sacrifice of Londoners in following the expert advice to stay home and save lives, we have not had to expand the Nightingale's capacity beyond the first ward. As the Prime Minister has said, we are now past the first peak in coronavirus cases, and the NHS is therefore moving into the second phase of its response to this global pandemic.
It is a sign of how far we've come in the space of a month. London's hospitals never were completely overwhelmed. And it is the same with Nightingale hospitals across the country. They also have been little used, or in some cases not at all. So now attention is turning to those who have had COVID-19 and who now need help recovering. There is the temporary hospital at the Principality Stadium in Cardiff, the Dragon's Heart, and in Surrey today, the opening of what was Headley Court, a rehabilitation unit once for Gulf War veterans. Renamed the NHS Seacole Centre, it will now care for those patients who face weeks and months of rehabilitation.
What we know now is that for a while after patients recover, their lung capacity is a bit compromised, and therefore they need help with breathing exercises, but also because they're not breathing or haven't been breathing properly, mobility can be compromised, particularly for our frail elderly.
NHS England has never said how much the Nightingales cost, but Scotland spent $43 million on their Glasgow centre, so there is at least a ballpark figure. So given how underutilised they were, the Seacole Centre will wisely perhaps also take other patients needing rehabilitation from more routine treatments.